Hi, everybody. Thanks for coming back. This is again my journey from having a laparoscopic robotic hysterectomy. I had my very first check-in with my doctor. I was a little late. I was supposed to have it at 2 weeks, but we couldn't get in, so I had to have it a couple days past 3 weeks. So I had that on Monday, and very happy to say that everything checked out. Kind of went over with her just some soreness that I'm having. So she explained to me that unfortunately we wanted to do 4 incisions. That was going to be what is the normal for this type of procedure, but I had some scar tissue from some previous surgeries that I had to have on my stomach, so she had to do 5 incisions instead of 4. And 2 of the incisions, one that was on my left side, it's kind of by my rib area. That's where the robotic was. So she said just kind of that it goes in and out a little more, so it's a little sore, and that's exactly what I told her. And being that it's right by my ribs, to kind of lay on my left side, it just hurts a little bit more than the others. And then the one that it was should have been in my belly button area, but that's where we couldn't get it, so we had to retry. She had to retry a different incision, which is probably about 2 inches above my belly button, and that's where the camera was. And same situation where she said it was kind of like in and out, a lot of movement during the surgery, so that's still sore too. I am definitely a stomach sleeper, and that's not able to happen yet. But besides those things, I was able to get all the restrictions taken off, which basically the restrictions was just to take it easy, get a lot of rest, and not to lift anything over 5 pounds. So she did take that off. My instructions now are to get back into my activity slowly and definitely listen to my body. And if I need to, still get help from my family, which is what I plan on doing. And I can start to slowly work out. Again, she just kept reiterating the slow part, which is hard for me. I want to just jump right back into my normal routine that I did prior to the surgery. But I definitely know that I don't want any setbacks. That night I did kind of bend down, and I almost felt like a little pop in my stomach, and then it was sore again. So it kind of, irritated something in there. Who knows? But everything was fine, and then just some ice pack over that night and the next day, and it's fine now. So I'm going to slowly get back into doing things. Going to start with some light stretches. I go back to her in, she said 6 weeks, and then everything should be fine. And as of right now, the inside sutures are still there. She didn't check, but she said that's normal, so she wouldn't even check at this point. Those take a little while to dissolve. So everything on the outside is done. It was glued shut, all of my incisions, and that's all gone, and everything is healed up as far as the skin. So for the incisions, excuse me, as far as the incisions, usually after a laparoscopic, because I have had them previously, you kind of get like a little scar tissue right around it, and you kind of have to massage it out a little bit. So I have been doing that. I kind of got it down to less than the size of a pea, and I'm good to go. So please, if you like to, and you're going through the same thing that I just went through, like, subscribe, and I'm going to try to post weekly about maybe little movements that I'm able to get back to. I would like to get back in, like I said, into my workout routine. So different things that I'm going to post on here that are suggested just to slowly get back into it and just kind of keep you updated. And hopefully, like I said, if you have to go through this, be patient and rest. All right, take care.